One fine morning when I came back from my gym exercising, I just sat down on the couch, and believe me, for the next 20 minutes, I just experienced such a deep pain that I couldn't move my neck. It was just, tilted on one side. Still, I took some ibuprofen or another painkiller during the day. Nothing improved. So much so that I couldn't even put my head back on my bed. So I was just sitting on my couch the entire night. When the pain was unbearable and the tears were rolling down my eyes, we rushed to a spine hospital which is nearby. And there was a doctor on duty in an emergency who told me it seems like a muscle spasm and I should for 48 hours continue with some more painkillers. By the end of 48 hours, 3 of my fingers had completely stopped working. I couldn't even lift a pen. My MRI results were disastrous, and they said that if it isn't treated immediately with a surgery, there is no respite. I consulted 2 or 3 neurosurgeons thereon in 2 or 3 different hospitals in Delhi, and all of them told me that the surgery is really tricky. It is like a 50-50% chance because all the nerves are concentrated here, and if any other nerve gets pressed, I could just come out like a vegetable. You can imagine with 2 small children by my side, with a family, and I'm about 30 years of age, or it's not such a healthy thing to hear. My husband just mentioned to me that, why don't we try some alternatives? Honestly, not going with much of a faith on that, but not having too much of a choice.
Many traditional methods of healing are based on the principle that there's this vital, life-sustaining force or energy that flows through every living being. The Chinese refer to this energy as qi and say that it flows through our bodies through channels called meridians. Now, it's said that when this energy is either blocked or depleted or imbalanced in some way, that disease appears in the body. Now, the ancient Chinese art of acupuncture is also concerned with the optimal flow of energy. Acupuncture is one of the oldest forms of medicine. And though we may not know exactly how it works, we do know that not only did it work for Archana Datta, but it has a track record that is thousands and thousands of years old.
I myself had suffered a backache for a long time, and it's been with me for about 15-20 years. And when I was getting myself treated, I did did go out and experience acupressure and puncture at that point in time as well. But when Archana's case came up, one felt that one should give it a try because I heard so much about it. And then one colleague of mine in my office had completely a miracle case in hands of Dr. Tuli, and she referred me to him.
What was your integrated diagnosis of it?
She had a excess yang, the wind energy is disturbed, and that is what is like the wind conveys movement, and that pain when it shoots, when it travels, is called to be due to the excess wind in that condition.
Now, what was the actual treatment like?
Well, the actual treatment, I was pretty scared in the beginning because there are at least 50-60 needles which go into you. But it's not so bad in the sense that you just get used to that little twitch in the skin. It just bothers you for 1 second,
so it's not painful?
It's not painful at all. In fact, I started enjoying it, honestly. I mean, the way these needles are poked and then they pass on some little current to you. I mean, and the way you just relax for the next 45-50 minutes. I mean, fantastic soothing music playing by your side. You just are in some other world. It relaxes you so much that you feel, okay, I want to go on with it for some more time. Well, it wasn't, it's not painful at all.
And how long before you started to see changes?
It took me about 4 weeks to start getting back into shape, as in doing things on my own again. It was quite a bad case, as I told you. And by the time I was completely cured, it was about 2.5-3 months.
So where before you were not open to alternative therapies, you are now quite open.
Yeah. Well, I would say go the natural way now. I've changed my thought process, honestly, and I would recommend that as far as possible one should just probably, give an alternative therapy a chance rather than just straight away popping a pill like me. Yeah. Now I'm the last one to pop a pill. I used to be the first one always.
People are becoming more and more aware of the vast amounts of chemicals that we're putting into our bodies, whether they be from medicine or from food. And methods that rely on nature or on the body's natural ability to heal are becoming more and more acceptable forms of treatment, even amongst doctors of Western medicine. The way I see it is that if you know that there's a possibility of healing yourself without surgery and without the use of drugs, which can have serious side effects, why wouldn't you try and find out more? Acupuncture to me definitely seems worth exploring. The ancient Chinese art of acupuncture dates back to the Stone Ages, and it is said that as long ago as 3000 BC, the Chinese noticed that soldiers wounded with arrows sometimes got relief from diseases which had been troubling them for years. Now, whether or not this is true, the Chinese were led to evolve a system of medicine that cured disease by penetrating the skin at specific points. Acupuncture literally means to puncture with a needle. Now, some believe that acupuncture may have originated in Eurasia, but it was the Chinese who first systematized it in the first book on the subject, called the Yellow Emperor's Classic, in 200 BC. And since it has spread throughout the world, from China to Japan to Korea, Vietnam, and then to the West.
The Chinese have described human being as made of the 5 elements. Cosmos is made of the 5 elements, so is the microcosmos. We are made of the 5 elements: wood, fire, earth, metal and water. Now these 5 elements, once they are in a state of harmony, we are in a state of health. If this harmony is disturbed, it becomes a disturbed ease or a disease. Through the use of these acupuncture needle, we are able to remove the disturbance, restore the order and thereby the ease. The individual is made of the invisible factor of that life force, that energy, which is termed Qi in Chinese. As the Qi flows along well-specified pathways in our body called meridians or channels, along these meridians there are specific points where the cosmic energy or the Qi enters and exits from the human being. This is a continuous process. We are all the time gaining or losing energy into our environment. And along these paths, through these spots, as the energy travels to and fro, enters and exits, that's feeding our meridians, which in turn are feeding all our organ systems in the body and giving us life and health. Through the study of acupuncture, as doctors, we learn the flow of this energy in the body, how it is regulating, controlling and coordinating the functions of not all the major organ systems but each cell in the body, and how this can be coordinated. And that is manipulated by using of hair fine sterilized pins, which I relate work like mini antennas.
I had a thyroid problem for a long time, and resultantly there was lack of energy and a lot of migraines, and carrying on with one day in a normal manner was an ordeal for me. My energy levels have changed. I wake up in the morning feeling fresher. Earlier it was I wake up in the morning and I wanted to go back to sleep. I used to wake up tired, but now I'm full of energy and I want to carry on with the day with complete enthusiasm. It's really changed.
Western medicine puts great emphasis on the anatomy and physiology of the body. On the other hand, the very foundation of Chinese medicine and of acupuncture, which is rooted in philosophy, is based on the concept of energy, something which isn't easily understood in terms of Western medicine. There's a difference in the very basis of the two branches. So how could trying to explain acupuncture in scientific terms be easy? Something tells me that it's probably the reason why we still don't have definite answers on how exactly it works, even though a lot of scientific research is being carried out. But I'm definitely getting more and more curious about it as we speak. We perceive the world through our five senses, so it's only natural that we want to be able to explain everything from the human body to acupuncture to the universe in terms which our five physical senses can understand. But it's been proved to us time and time again that what we perceive is only a fraction of what there is to perceive. Our brains aren't geared to pick up TV waves or to hear dog whistles or to see subatomic particles, but yet we accept that they exist. The same is true for our physical bodies. They generate and are subject to life forces, some of which are measurable, but many of which can only be experienced or appreciated by the mind.
Could you please lie down now? So we do a brief clinical examination. Just open your eyes, please. Just look up. Show me your tongue. Now I'm going to record the energy levels in each of your 12 pairs of channels, of the major channels.
Cool.
And we would through this software, which will pick up these energies, analyze and then display it all in the form of various graphs. Okay, I think largely your graphs are quite good. Now please, color green means normal, blue when the energies are low, or it's red when they are very high. So generally we look at that the graph comes within the normal range. Now feel relaxed. I just put these little covers underneath these so that sometimes accidentally, normally when we burn it gets reduced to an ash. Moxa basically nourishes your chi, generally help improve your chi, and chi turns into all your vitality, your life force, your immunity.
I'm incredibly calm and relaxed. I came into the session with a mild, heavy head, which I didn't really mention, but that isn't there anymore. It's interesting that the actual needle prick didn't hurt at all, but when certain acupuncture points were stimulated, I did have a sort of stinging sensation which eventually subsided. It's a little hard to say what long-term benefits this session will have because I didn't come in with any acute symptoms, but I'm definitely willing to give it another shot.